I want to turn our attention to the story that we've been talking about throughout this as we concentrate on what has become, as you well know, the epicenter of this virus, and that is in long-term care centres. And because that happened primarily in Ontario and Quebec, which were hardest hit, hundreds of soldiers and military medical personnel were deployed to play a critical role, both here in Ontario in those long-term care homes and in Quebec. Lieutenant Colonel James Stalker is the commanding officer of the Territorial Battle Group 1, and his soldiers are helping do some of that care in facilities across the Greater Toronto area. Lieutenant Colonel Stalker joins us now. Good to see you.
Good morning, Ms. Martin. How are you?
I'm good. Please call me Rosemary. I know that's how the military is trained, but please feel free to call me Rosemary. So thank you for making the time, because we did want to highlight some of the work that many soldiers have been doing. Can you give us just a sense of what kind of things people are doing inside the long-term care centres?
Yeah, certainly. I want to start by thanking you very much indeed for your interest in our work there. So the work the soldiers are doing in the long-term care facilities, and it's soldiers, sailors, and aviators as well, is really tremendous work. It's the shift breakdown in the homes is a mix of medical personnel, and those medical personnel are led by a nurse and a team composed primarily of medical technicians. And they're augmented by some what we call general duties personnel. So the medical teams will do what you'd expect medical teams to do, primarily clinical work and direct patient care for the residents in those facilities. Our general duties personnel augment by doing tasks like disinfecting, like cleaning, like laundry, like food portering, and even some light organizational work for the homes. It's an integrated team, and the team itself is integrated into the larger staff metric within the home. So they integrate within the larger staff of the facility itself. So
they're sort of doing anything they can to help, whether they have medical training or not. Is that fair to say?
That's correct. We're there as a supporting agency. We're there in support of the civil authorities, and we're there to support those homes in any way we can.
So you yourself have been deployed to Kandahar. You've led other big organizational logistical missions with the G8, G20 summits, and I'm sure many of your colleagues, other soldiers, have done all sorts of different kinds of missions. How was this one different, given the nature of the work? How did you prepare for it?
It's a great question. I think that every mission is singular. Every mission has its own unique challenges, but this is perhaps more unique than most. I don't think any soldier or sailor or aviator envisioned working in a long-term care facility, but this was the need of Canada and Canadians, and it's a way for us really to serve. And I think that military personnel are driven first and foremost by a desire to serve, and this is how we can serve Canada and Canadians in their hour of greatest need. So if I was going to offer sort of one word to describe the mood or the tenor here, it would be motivated, and motivated to help, and motivated to help as part of a broader pan-governmental response to this crisis.
What kind of training did the non-medical soldiers get? I understand that there was sort of a 30-minute video on some do's and don'ts around COVID-19, and I wondered, was that enough preparation for, as you say, a mission that is so unusual, that is really unprecedented?
What I would offer is that the soldiers of TBG-1 have actually been preparing for this for a little bit longer than that. So TBG-1 was formed as a rapid response unit in response to both the COVID crisis, but also the potential of floods and forest fires, other domestic emergencies. And we actually deployed to board and back in early April. And from the beginning of that deployment, we've been following pretty strict social distancing and forced health protection measures, frequent hand washing, training in personal protective equipment, distancing, et cetera. And then there was additional specific training for this mission in terms of care for elderly residents and advanced training in the donning and doffing of personal protective equipment. So I think the TBG itself was actually quite well prepared for the task.
Okay, that's good to know. You talked about PPE. Obviously, that's critical for all of you, keeping one another safe as well. Are soldiers, are they wearing N95 masks as a rule of thumb, or how do you make a decision about who wears them and who doesn't?
It's another great question. So the decision on which PPE to wear in what situation is driven by medical guidelines, by the provision of advice of medical authorities, be it the Public Health Agency of Canada, be it our own CAF health network. And so they have pretty stark guidelines on what PPE to wear in what situation, depending on the level of risk, depending on the level of potential infection, and we really conduct ourselves accordingly. So whether it's a breakdown by sort of by zone, whatever the case may be, we follow the relevant what we call IPAC infection prevention and control guidelines for each facility and for each zone.
So you're not systematically wearing an N95 mask. Would that be fair to say that sometimes you might be wearing a regular surgical mask?
All I can offer on this is that we follow the guidelines of medical advisors. So they offer a range of guidelines depending on the situation, and we simply conduct ourselves accordingly. And we found that really to be the best practice for our people.
I know last week we had confirmation that there was one soldier who had contracted COVID-19 in Ontario, and then more in Quebec. Can you give us any sense of whether that number has increased, and how you are then protecting one another, given that happened and everyone was aware that was part of the risk, I guess?
Yeah, definitely every deployment has risks, and this is one of the risks on this deployment. I'll actually answer the second part of your question first, which is we have quite robust isolation and treatment protocols. I can't really get into specifics because there's matters of medical privacy, et cetera, involved there, but we have quite a robust procedure in the event that someone is symptomatic or positive, and that is all subject to the best advice, again, of the medical professionals who are part of this comprehensive team to assist these homes. In terms of the numbers themselves, unfortunately, I'm not the release authority for that. Any numbers I could provide to you would be preliminary. So the next government update is scheduled to be released on the 29th, and that will provide you the most consolidated and accurate figure. That's great.
Let me ask you this too, Lieutenant Colonel. It would seem to me that this could potentially be very emotionally draining. The Prime Minister talked at one point about how soldiers shouldn't be looking after seniors, and I think everyone agrees that this is something that we're going to need to correct moving forward. I only have about a minute left, but how are you dealing with that, the deep sadness of this as well, the emotional toll it's taking?
There's certainly a very serious sort of human aspect to this, and how my soldiers are dealing with it, soldiers, sailors, and aviators, is really in terms of giving back. So one salient anecdote that I might leave you with is our soldiers and sailors and aviators, in their few off minutes in the homes, have been going above and beyond to help out the residents. So I do have one report of one soldier who's quite a gifted piano player, as it turns out, and in his spare time, such as it is, he plays piano in one of the homes, and it immediately sort of lifts the atmosphere a little bit. And it's one of those human touches that we can add.
Lieutenant Colonel Stalker, thank you so much for making the time, and thanks to you and all your colleagues for the hard work you're doing. We do appreciate it, sir.
Thank you very much indeed.